Life is funny. We like to think we're in control, washing our hands, eating well, or maybe even sometimes jogging in the morning. But somewhere out there, there are some little tiny troublemakers, like viruses and bacteria, for instance, or even our bad habits. And they are playing their games. And these games they are playing, sometimes they win. And that's where epidemiology comes in. Think of epidemiology as that detective or investigative officer that's going after a thief. But instead of going after thieves that steal jewelries, for instance, it's going after those things that are stopping you from being healthy. And we are using epidemiology to ask relevant questions like, who is falling sick? Where are they? When did it start? Why is it spreading? And most importantly, how do we stop it? It's like an investigative series, but the suspect here may just be flu or cough or a dirty water well in a village that's taking people's lives one by one, or even a habit like smoking, for instance, that's gradually just taking people out of the picture gradually. Imagine a town where suddenly 50 people just get the same stomach problem. Without epidemiology, that would be chaos. But with epidemiology, we're able to ask the relevant questions. We start by testing the waters. We look at the food they're eating. We try to track, where people are buying their foodstuff from. Maybe the grocery store. And the process of going there, we eventually find out this a truck, and that was the truck that has been causing all the problem. Problem solved, people's lives saved, just because of epidemiology. Epidemiology also looks at things like car accidents, mental health, nutrition, and why some neighborhoods live longer than others. It tells us where we are as a community, how we got here, and where to turn to next. Now, community health, that's epidemiology's best friend. If epidemiology is the detective, community health is the builder. Once you find a problem, community health comes in with the right tools and the teamwork to fix it. For instance, if your roof is leaking, epidemiology spots the leak, and community health serves as the builder that fixes it. And not just only fix it, but tell the whole neighborhood and the whole street how to prevent leaks. Community health is not just about an individual. It's about people. It's about family. It's about the whole community. It's about you. Here's what epidemiology and community health boil down to. 1. Prevention first. It's way cheaper and kinder to stop a disease than to treat it. 2. Data is our compass. Numbers tell the truth, but if you know how to read them. 3. Health is a team sport. Doctors, nurses, farmers, everyone, even you, yes, you, play a part. And then 4, one size does not fit all. Just because a solution works in one place doesn't mean it will work in another place. So solutions have to be made in such a way that they fit the people, they fit their culture, and they fit their peculiarities. By the way, epidemiology is not just about statistics. Behind every case is a face, a name, a family, a dream that will be cut short unless we act. During an outbreak, all those numbers on a spreadsheet are someone's mother, someone's child, someone's friend. And every public health measure we take, like wearing face masks or boiling water, is a way of saving ourselves together, but saving strangers elsewhere. For instance, mosquito that bites a person in this country can eventually hitch a ride on a traveler and go to another country or even another continent and bite someone there. So our health is more interconnected, intertwined than we think. Here's the scary part. The moment we think the job is done, disease shows that they are still here. Stop vaccinating. Old diseases will creep in, will creep back. Or ignore pollution. That pollution will show up in your lungs. Or just take mental health to be something that is unimportant. You eventually begin to see that we'll lose lives silently. So epidemiology and community health are not one-time projects. They are ongoing battles and struggles and measures we take for our health and for our lives. The good news is, when we get it right, it's beautiful. And it means kids can grow up without polio. It means families can have safe water to drink without fear. And it means the neighborhood can be safe and we can all thrive because everybody has played their collective role in ensuring the health of everyone. So epidemiology and community health is not just for doctors and nurses. It's for you. It's for me. It's for the lawyer in the courtroom. It's for the driver in the bus. It's for the woman in the market selling her stuff. And so the question comes, will you just watch this video and just, will you watch the video and just, or will you take your active position and play your role in ensuring the health of your community?